Public sector nurses and midwives are rallying in their own time at hospitals across the state today, fighting for a 15% pay rise.
The Nurses Union is holding rallies at 50 locations across 4 days.
We deserve more!
The government has offered a 10.5% pay rise over 3 years. The union is asking for a 15% increase in 1 year.
We are working double shifts. We are working overtime. We are working casual shifts at other hospitals. We are exhausted.
What do we want? 15%! When do we want it? Now!
New South Wales nurses and midwives are the lowest paid in Australia. This is not living, this is barely surviving. Not only are mortgages getting harder to repay, our general bills are getting more expensive, food prices are on the rise, and every time I'm at the grocery store, I need to choose between fresh or frozen to make ends meet.
We deserve a 15% pay rise, not just for the living wage, but also because we are a female-dominated industry and our wages have been suppressed by Mookie, Mins and Park.
A 15% increase for nurses means that we can live and work in the communities that we serve. It also means that we'll attract and retain appropriately skilled and qualified staff.
A major impasse for the state government is that these nurses can travel up the road to Queensland 4 hours and be on an extra $10,000 every year.
New South Wales is currently hemorrhaging nurses, predominantly to Queensland. Queensland have ratios, Queensland are paying their nurses better. A new graduate nurse makes $12,000 a year more than a new graduate nurse in New South Wales. And when we're living in the most expensive state in the country, not just our nurses, but our community deserve better.
1, 2, 3, 4. We need more in 24.
I'm tired of struggling to keep on top of my workload at work and struggling to keep on top of my bills and the cost of living at home. The health system is at breaking point with record-breaking presentations to emergency departments and nursing staff who are leaving to become baristas because of the abysmal working conditions.
We deserve more in 2024.
It is about time this government stepped up and started taking us serious.
They offered us 10.3% over 3 years. That is 3% a year is all they think we are worth, yet they expect us to come and work in a failing health system.
There is a gender pay gap that exists between New South Wales professions. Wage discrimination exists and is felt by nurses and midwives each and every day.
No, we are not going to accept your 4% because it is not enough. We deserve more. Fix the mess.
Stop that distress.
1, 2, 3, 4. We want more.
What do we want? 15%.
When do we want it?
Now!
Nurses and midwives in New South Wales wages are actually sitting at 2008 levels and we're working at 2024 workloads.
We're going to need another 70,000 nurses across the country to meet demand of 2035. And if New South Wales wants to recruit any of those additional 70,000 or hang on to the 53,000 they currently have, they're going to have to pay you better. Am I right?
Yes!
It's exhausting, people are tired, people are burnt out.
The Nurses and Midwives Association says the Tamworth Hospital is short-staffed most days and struggles to attract staff to fill its vacancies, which is taking a significant toll on workers.
Because we're worried about the people of New South Wales. We're worried about our colleagues.
Stop me from going to Queensland Health by giving me a 15% pay rise.
This government must do better if they want to see health services keep pace with the rest of the country. It's not good enough.
We are so understaffed that I've done over 200 overtime shifts in the last financial year just to help staff.
We're seeing a wage increase in aged care that has recognised historical undervaluing of women. Here in New South Wales, with an 85% female workforce, we have a government saying, no, we're not going to do it.
What do we want? 15%. When do we want it?
The 15% pay increase is not just a request. It is an essential to ensure that we don't fall further into financial hardship.
A 15% pay rise will give New South Wales nurses a reason to stay.
It's time for this government to step up and truly support those who are the backbone of our health care system.
You've got to pay us properly. Simple as that.
We are ready to fight. We are not going to take any more bullshit from them.
Woo!
We're out here rallying, campaigning for our 15% because nurses are angry. We're out here to get the government and the public support for our pay claim just to bring us in line with the other states and the other public servants in New South Wales. That's all we're asking for and we deserve it.
Keep up the fight. Keep up the anger. Maintain the rage, people. Maintain the rage.